Nobody really wants to grow up to be the person that lots of people dislike. But as a child, my mum's friend, who's beautiful and blonde and bubbly, she was such a big influence in our lives when we were younger that I just grew up thinking, oh, I want to be just like her when I'm older.
So you became a dentist. Tell me about Dental Mavericks and how you got involved.
I became involved with Dental Mavericks last year. My boss was initially supposed to go and his wife found out she was pregnant, and so that he wasn't able to make the trip because the baby was due when we were away. So they asked if I would take his place, and I didn't have to think twice about it. I jumped at the chance.
So tell me about the charity.
The charity was set up by Callie and Tony Gedge. They set the charity up on their 40th birthdays because they realised that they wanted to do something more with their lives than just dental marketing, which is where their business was. They were involved with a lot of dental practices and have been travelling in Morocco and seen quite a great need for dentistry over there. So they sort of recruited a small core group of other dentists and decided to go over. On their first trip, they went over, treated kids at their school desks, with very, very, very little equipment and no licence. They didn't know they needed one. And from there on, it's just grown.
Mm-hmm. So you took your boss's place when he couldn't go. Did you know what to expect on your first trip?
No, I had absolutely no expectations. I didn't know anyone that had been. So I realised, obviously, going to work abroad, it's probably best not to have any expectations and just see where the trip took us.
So what happened on the first trip? Because it wasn't particularly well organised, was it?
The first trip, it didn't quite go to plan in the beginning. The Moroccan government, unfortunately, impounded their equipment for quite a considerable amount of time. So that obviously impacted on the amount of time we were able to treat the children. We used the time really well to bond the team and find out all about each other, find out how everybody works. So when we were able to set up the clinic was up and running like a well-oiled machine within a couple of hours. So that was really useful.
And tell me about the children that you saw.
Oh, I've never experienced anything like this. I've worked in areas of Glasgow where there's a lot of deprivation and a lot of dental deprivation, but these children come in with beautiful big smiles, but wall-to-wall decay in their teeth. It's terribly sad. Kids have been in pain for months, sometimes years. It's a really sad state of affairs.
You normally wouldn't expect children to be excited at the prospect of seeing a dentist, but these kids were.
Yes, exactly. Normally kids don't come skipping in to see us, that's for sure. But these children they were amazing. They were so brave. They would sit. We took 10 teeth out of a little girl last year who came back this year to visit us just to give us a hug to say thank you, which is absolutely incredible.
And what kind of conditions do these kids live in? Because obviously we are talking about extreme poverty.
Yes, we saw the real sharp end of that on the second project that we went to this year. It was a place in the Rif Mountains called Marshgala, which the Moroccan government, up until recently, they didn't really recognise the people of the Rif Mountains because a lot of drugs are grown and manufactured in the area. So the area had just kind of been left to rack and ruin. All the kids that came, they were all pretty malnourished. The clothes were pretty threadbare. A lot of them had impetigo and a lot of them had head lice. But you can't help but just want to hug these little kids, you know. It's so sad to think that they don't really have sort of basic human needs.
And quite a culture shock or a culture contrast between the work that you do here in Glasgow with your comfortably off clients.
Yes, I work in the south side and it's a beautiful practice with state-of-the-art equipment, and I have everything that I could ever want in my surgery. To go from that to setting a chair up outside at a farm because there's no more indoor space to treat kids it's quite different. It's definitely the flip side, but it was an amazing experience. It's so humbling, you know.
And you fund all these trips yourself?
Yeah, we do. We all pay for our own trips, pay for our own flights, and then we also raise money for the charity as well. We want to implement a Teeth for Life programme in the areas where we go to work, so we're not just going once a year to sort of smash and grab and take teeth out. We want to implement a structural programme so that we've got a nurse going into the school to give sort of continued oral hygiene instruction, and to sponsor a dentist from the nearest city, which is about 2.5 hours away, Chef Challen, to go in and do checkups and more regular treatment for the children.
Did you ever see when you were starting out that you'd end up becoming so involved in a charitable endeavour like this?
I always hoped to. I think everybody that goes into healthcare, you have a little bit inside of you that you just want to help people, and often that takes us down paths where we are working more and more in sort of private environments, or we're working under very strict guidelines and restrictions by the NHS. So it's really lovely to be able to go out and do exactly what you want to do to help people. That's why we're all there.
And would you like to see the programme expanded to other countries?
Yes, we have plans to do that once we've got a sustainable Teeth for Life programme in El Jabaa and hopefully set one up in Marshgala. We're looking to move a little bit further south into Senegal.